Today, we're going to talk about Follitropin Alfa Pen Injector. This medication contains follicle-stimulating hormone, FSH, and is used to treat certain fertility problems in women. It helps stimulate healthy ovaries to produce eggs and is usually used in combination with another hormone, HCG, to bring about the growth and release of a mature egg, ovulation. It's important to note that this medication is not recommended for women whose ovaries no longer make eggs properly, primary ovarian failure. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before you start using Follitropin Alfa, be sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, it's important to check for any particles or discoloration in the liquid. If you notice either of these, do not use the medication. If the medication is stored in the refrigerator, allow it to warm to room temperature before use. You will likely be directed to inject this medication under the skin or into a muscle by your doctor, usually once a day. Your doctor may also direct you to use this medication in a treatment cycle, such as only on certain days each month. It's important to carefully follow your doctor's instructions. Before each dose, be sure to clean the injection site with rubbing alcohol. Also, be sure to change the injection site each time to prevent injury under the skin. Use only the pen needle provided with the pen, and use a new pen needle for each injection. The dosage of this medication will be based on your medical condition, response to treatment, and lab tests. It's important to use this medication exactly as directed by your doctor in order to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Finally, be sure to learn how to store and discard needles and medical supplies safely. Some common side effects of Follitropin Alfa Pen Injector may include headache, mild stomach/abdominal pain, bloating, redness/pain at the injection site, or breast tenderness/pain. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. You should inform your doctor immediately if you experience any serious side effects, such as bleeding from the vagina/uterus, flu-like symptoms, fever, chills, muscle ache, tiredness, or swelling of ankles/hands/feet. In rare cases, the use of Follitropin Alfa Pen Injector may cause a condition known as ovarian hyperstimulation syndrome, OHSS. If you develop severe pain or swelling in the lower abdominal area, severe nausea/vomiting, sudden/rapid weight gain, or decreased urination, seek medical help right away. While a serious allergic reaction to this drug is rare, it is important to seek medical help immediately if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA. In Canada, you can report side effects to Health Canada and seek medical advice from your doctor. Before using Follitropin Alfa Pen Injector, make sure to inform your doctor or pharmacist about any allergies you may have, especially if you are allergic to products containing follicle-stimulating hormone, FSH. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Additionally, it's important to discuss your medical history with your doctor or pharmacist, especially if you have any fertility problems, abnormal bleeding from the vagina/uterus, thyroid or adrenal gland problems, cancer of the reproductive organs, brain tumors, ovarian cysts, blood clots, heart diseases, lung problems, or if you are using any other prescription or non-prescription drugs, and herbal products. It's also important to note that using Follitropin Alfa Pen Injector may increase the likelihood of multiple births, so it's essential to consult with your doctor for more details on this. If you become pregnant while using this medication, it's crucial to stop using it immediately, as this medication must not be used during pregnancy. If you suspect that you may be pregnant, inform your doctor right away. Lastly, if you are breastfeeding, it's important to consult your doctor before using this medication, as it is unknown if this drug passes into breast milk. When using Follitropin Alfa Pen Injector, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Follitropin Alfa Pen Injector is gonadorelin. Always consult with your doctor or pharmacist before taking any new medications while using Follitropin Alfa Pen Injector. Remember, your doctor knows your medical history and can provide the best guidance on how to use this medication safely. If someone has taken too much Follitropin Alfa Pen Injector and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can also call a provincial poison control center for assistance. It's important to remember not to share this medication with anyone else. Your doctor may also want to monitor you with lab tests and medical exams while you are using this medication, such as vaginal ultrasound, hormone levels, and liver tests. Make sure to keep all of your medical and lab appointments. If you have any questions or concerns, consult your doctor for more details. If you forget to take a dose, consult your doctor or pharmacist to help you create a new dosing schedule. Do not take a double dose to make up for the missed one. When using the Follitropin Alfa Pen Injector, it's important to store the unused pen in the refrigerator. If necessary, you can also keep it at room temperature for up to 3 months. Once the pen has been used, you can store it in the refrigerator or at room temperature, but make sure to discard it after 28 days. Remember to protect the pen from light and avoid freezing it. Also, do not store it in the bathroom, and keep all medications out of the reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the pen when it is expired or you no longer need it, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.